informed that the blood thinner he was on for a couple of reasons is the levels had gone from normal to abnormal over the night. Now, he's been on this medication for about 2 weeks, and every day we check the levels, and every day they're perfectly fine. The reason why the levels went super therapeutic, we don't know, but we have a few thoughts about why. Okay. Um, so what we did, I called the cardiothoracic surgeons. These are the guys who do open heart transplants and open heart surgeries and all those things. I told them that he's actively bleeding out of his chest, and I need you all to come quickly and consult because we may have to do an emergency surgery. Um, they came by and they said that they really couldn't do much until the blood thinner was out of his system. So I quickly used the medication to reverse the blood thinner, and I also treated him with some medications that would thicken his blood called plasma. Okay, and I gave him blood transfusion to bring his blood levels back to normal. Okay, so after all of this, he seemed to be a little more stable, but he still had an active bleed. Surgery said that once the thinner was out, they came back by and they said that they probably would take him to surgery today to clean out all the clotting that was inside of his thoracic cavity. Okay, I talked to you about this, and so what happened is I want to talk to her exactly. The reason why is because sometimes we should have to step back and just kind of assess the whole picture. So he got here about 3 weeks ago for a wound he had in his leg, and the wound really wasn't a big problem, but while he was here, he developed a pneumonia. And the pneumonia that he developed was not a pneumonia that you would typically see in the hospital. It's usually what happens, something you would get from outside of the hospital. So we treated him for what we call a community-acquired pneumonia. We call it CAP. And in that pneumonia, he got complicated and developed something called ARDS. ARDS is an adult respiratory distress syndrome, acute. It's inflammation inside of the bottom part of the lungs where you develop lots of pus, but there is no bug in there. It's just that the body is fighting off what was already there, and it goes too far. So he developed that, and we treated him for that. We gave him the ventilator and helped his lungs to rest so they could, recuperate. And he started to get better, and then he got complications and developed another pneumonia, and his ARDS worsened. Okay, this pneumonia was a pseudomonas. It was something that you would see in a hospital. So oftentimes in the hospital, there are bugs here that you really wouldn't see outside of the hospital. So we treated him for that, and we gave him a roto bed to help him with his oxygenation in his lungs, and he got worse, then he got better, and he was on the road to getting better over the last few days. Even his oxygenation and his numbers and everything was looking good. Until this morning, we were trying to figure out what happened, and the bleeding, we don't know why, but we do know that his kidneys had started to go out on him. And this medication he was on, it's partly broken down by the kidneys. And when the kidneys don't work, it's not broken down, so the levels possibly could have risen overnight because the kidneys weren't working as they were over the last few days. Okay? So again, we step back. Why are the kidneys not working? Really don't know. Okay? What we do know is that over the last few weeks, he's had a little bit of strain on his heart, and sometimes when the heart is not working the best, it doesn't pump enough blood to the kidneys, and the kidneys have something called ischemia, meaning they don't get enough oxygenation, and the kidneys then start to have some failure. Okay? So now, there were a few things I had to talk to you about because of what happened today. The big thing was, do you want surgery? Okay? The fact that he smoked for 50 years, it increases his risk of death during surgery already in a frail habitus as he is right now to a very high percentage. So we have to be careful with that. had to talk to you about that. Also, I had to present to you the things that have happened and the fact that he has a few organ systems that are failing. Okay. Um, Also, I didn't mention just now also that when his blood was thinning, it makes all the blood in the body thin. So you have the ability to bleed in every place. Okay. And one of those places is the brain to be able to bleed. And we're not sure if he's bleeding in his brain, but the nurses contacted me while I was seeing another patient, telling me that his neurological checks that we do every 2 or 4 hours, when they came back different than usual. He wasn't responding to the pain, and he wasn't responding to a rub on his chest or on the bone, the sternum here, that usually he would move his hands towards because it was painful. So that's a change. So we look at things like this and see those acute changes mean a lot to us. Something's going on that's not usual because he's been fine for all this other time. And we wanted to get a CT to check to see if there was an active bleed because there was a bleed here in the chest from the blood being thin. And we couldn't get a CT because he's on the ventilator. And that ventilator setting that he's on won't allow him to get a CT. We could change the ventilator setting, but it's highly likely that he won't be able to breathe on that setting, and it would definitely be detrimental to him. So we kind of stuck there. We can't just change that setting, and we can't take him to the CT. So we really don't have a way to see if he's bleeding in his brain. All we know right now is that his neurological status has changed acutely at the same time that he was bleeding everywhere else. Okay? So literature tells us that if a patient's in the ICU and he has organ systems that are failing, you can go by basically 19% adding to the risk of dying per organ system. So the organ systems he has right now, he's anemic, so that's the blood system. We call that an organ. His heart is strained. His kidneys are failing. His lungs are definitely not working well. And now his neurological status, which is his brain, his nervous system. So 19 times 5 is about 96%. And that's within a week, okay, week and a half. So I had to stop you and talk to you today and tell you about this happening because the risk of mortality is very high right now.
So, I don't know, are you finished, or did you want to say more? Because I have a question, but I can wait.
No, you can definitely talk.
When they do that surgery, do you have to cut through his chest again?
Yeah, they have to go through his chest.
I don't know. I'll talk it over with my kids, but
I have a question. If you do surgery for his chest, but you're not sure if he is bleeding in the brain right now, like what happens then? You fix him here, then how long do you have to wait to figure out if he's...
Based on the fact that he's on this setting, on the ventilator, it would depend on how well his lungs do before we can even talk about getting a CT. Now, the last time he was on this setting, he was on it for about a week and a half before we could titrate him down to something that was a little more normal for us. And so waiting a week and a half for someone who has a bleed in the brain, that's a long time. In this surgery, they would do two things. They would either go straight through the middle of the sternum and open him, or they would go through and take out a couple ribs and try to look in there that way with a video-assisted camera. And if they see something there, they would try to go and patch it. So that's the status right now. He got better and then kind of just got worse, and it happened a few times, and now he's in a very detrimental state, and it's very close to passage.
So the chances of him surviving any sort of surgery are pretty slim because his blood's so thin and he could bleed out?
No, his blood's not thin anymore.
It's not?
No,
it's fixed.
No, we fixed that.
Okay.
However, so here's the complication. With his blood not being thin, he has a mechanical valve, which he was taking warfarin for. And you need thin blood because those mechanical valves are known to cause clots that will go to the brain. It happens very quickly. So we have him off the blood thinner today, and we reversed it. So his blood is just as thick as every one of ours, as a normal person. And with that, he has an increased risk now to clot and send it to the brain.
Now that his blood's thick again, is he still bleeding in his lungs, or can you tell?
We can't tell. We put a chest tube in. He had a chest tube, but we took that chest tube out and put it in another place where the blood was. And now we drained what we saw, what was bleeding, and a lot of blood came out. I want to say I haven't looked at it now, but it was filling up pretty quickly this morning. And as for it being active, I really don't know. Only way they will find out if it's active is following the amount of blood that's in the chest tube, and also either surgical intervention to go and assess and explore to see if there was an artery or something that possibly just decided to rupture. So we are going to continue doing as much as we can. There's not going to be any stoppage, and we're going to continue treatment. But I just wanted to inform you, and you all, to let you know what was going on.
Was there something else that happened this afternoon that
Yes.
you called us in now?
So about 2 or 3 hours ago, I was on another floor and I got a call. And they said that his breathing became very shallow. Usually his breathing he gets enough, maybe 95 to 97% of oxygen in his blood. But he started breathing and it went down to 70s, 79. He was turning kind of blue, and it was an episode. And the physicians called me and asked me. They said, "You need to run down because he's not looking good." And he was not looking good.
Wow.
So we changed a few ventilator settings, but I had to call you because oftentimes when they get that low, we may have to end up doing resuscitative measures.
Yeah, that's fine.
So I had to call to see if it was okay before we started doing that, and you didn't want that.
What are resuscitative measures?
Chest compressions, shocking, IV medications to push the heart if it were to stop.
But you never ended up.
No, we didn't. The changes that we made got him back to a little more stable status. So that was it. I wanted to talk to you, and I wanted to talk to the family, let you all know what was going on, make sure you all fully informed. That way you can make the decisions that you all want to make, and I can just do whatever you ask. Okay?
What exactly is the purpose of the surgery, of which you speak? Is it to investigate or to solve, to fix something?
It's both. So in any person who has a bleed inside of their thorax, we would have to find out why it's bleeding. And two, when there's bleeding, there's clotting. And when there's clotting, it invades or it kind of impedes on the ability of the lungs to expand. So we have to go in to clean out all the clots and the things that built up and all the fibrin and things like that built up inside of his thoracic cavity because the bleed was active. On the x-ray, you can see the fluid level of blood pretty high inside the lung cavity. So when we put the chest tube in, some of it went down, but I haven't done the x-ray again right now to see if it's gone down further, but it was still a high residual after the chest tube was placed. So that's why surgery was involved.
And without doing any surgery, right now you say his condition is detrimental? Based on the organ failure?
The organ failure is
and
more.
if nothing is done, no surgery is performed, by all indication he's going to continue to deteriorate toward death?
By all indication, his lungs will not get better if we don't allow the surgeons to go in to, especially the right lung, the surgeons to go in and clean out what was built up after the bleeding. I'm not sure. Usually, because we had a chest tube in, and the chest tube was about midway up his lung, and I don't know how long he was bleeding within the thorax because it had to build up for it to come out. So it had to build up to the middle part of the lung before it started to drain out onto the bed and outside of the body through the chest tube. So how long that blood was there, I don't know. But as blood sits, it begins to clot and it begins to thicken. And the surgeons were pretty sure that that was already occurring, and that's why they were saying he's a candidate to go to procedure to at least go in and try to clean things out.
So from the numbers you gave us earlier, he's at about a 95-96% chance now. And if this problem was fixed with the surgery, then it would be still like an 80% chance.
So
'Cause of all
fixing this, it won't take away the fact that the lungs are already diseased right now.
So it's still...
Yeah, it's still high, because this is just one thing here. The lungs, he has a smoking disease. It is basically pathology due to smoking, as well as the pneumonia that the pneumonia causes scarring in the lungs, and he had ARDS, which also causes inflammation and scarring in the lungs. So those three things, outside of just the bleed that happened today, have him with the organ disease there. What happens in the ICU is after 30 days here, you have a really high rate of not doing well. He's been in the hospital for 3 weeks, but he's only been in the ICU for 2 weeks. So he still has, some time before that 30-day, it's not my number, but it's just what the literature says, before he reaches there. And I think he's gotten better and he's gotten worse. I really don't know how you all feel about that, but we can give him some time, I'm not saying that this is over, but I wanted to just inform you what the situation is and what you needed to know. I felt you needed to know.
She's got to give the permission for you guys to do surgery, right?
Of course.
That's what we have to decide.
She has to get permission, but I told her, maybe you should talk to the family before you just give me the decision.
Okay.
Okay, and that's why I wanted the family to come in and
So
talk.
this surgery is pretty stressful too, right? To cut
Yes,
open his chest again,
it is. It is.
but it's not as severe, I suppose, as the heart surgery you had 3 years ago.
No, we're not going to the heart.
Okay.
No. However, the surgeons told me that they're not comfortable with him going to surgery on the ventilator setting he's on,
I see.
but they will do it
Oh.
because with the ventilator setting he's on, he has a higher risk, even from already having a high risk. It increases the risk of not doing well.
If surgery is not done, would you need to make his blood thinner again, or would you leave it at the same?
So that's a very tough decision. If he has a bleed and we thin his blood, he is going to exsanguinate. If we don't thin his blood, he has a high risk for clotting in that valve and causing strokes in his brain. And I don't know if he already has had hemorrhage in the brain, but if we don't thin his blood, we increase the risk of him having a clot that goes to the brain, that forms in the heart around the valve that he has.
So because he's had a change in his neurological state with these tests you have given, he may have already had a stroke?
Right. There are two types of strokes. There's a active bleed and there's clotting. So an active bleed is a bleed that is building up pressure in the brain and it continues to bleed in there. And a clot can just block an artery and you don't get any oxygen into that area there is where it's clotted. Past the clot doesn't get anything to it. So if he has a clot go to the brain, that would cause a more of an ischemic stroke, meaning that no blood supply is getting past the clot. And if he has a stroke already from the blood being thin, that would be a hemorrhagic stroke, meaning he's hemorrhaging inside of the brain. But we can't check because of the ventilator that he's on.
It's a lot to process.
How soon do you need an answer about surgery?
So fibrosis, which is stuff that forms and kind of becomes very hard in the lungs, it takes weeks. But every day, whatever the clot is there, it'll get thicker and thicker.
Mm-hmm.
So, the time is on you, but just know that the further we go away from him having this bleed, the harder it will be for us to fix whatever is clotted there, or try to clean it out.
So if it did get to the point where, say we didn't give him surgery and we let him fight it the way he is now, and things turn like for the worse, and he was going to die, how much time would we have to know? Would he just die without us, just without a warning? Like, because if we all wanted to be here when he did die, would we have a chance to get here from our house, or how?
That's really hard for me to answer.
Yeah.
I'll tell you, based on organ system, kind of do it that way. If he were to have a hemorrhagic stroke and he's bleeding in his brain, his heart and his lungs and everything would stop, based on the fact that the stroke had swollen his brain so much and he herniated the brain down the spinal canal. That would stop immediately. Everything would stop. If he were to have a heart attack, that takes some time before you pass away. It takes maybe an hour or two, okay? If his lungs stop, and even with the ventilator, the lungs are not able to expand, that would take about 30 minutes or less, okay? And the kidneys, that would take the longest time. Kidneys take some time before you actually pass away from kidney failure. So that's where we are.
So what does the family do? If the family decides to have surgery, well then you will prepare and go ahead with that. If the family decides not to do the surgery, then what does the family do? Is there a decision to make?
So the decisions, if the family does not want to go to surgery, you would tell us what kind of care that you would like. Okay, we can do all the chest compressions and all the shocking and medication that we would do if he were to, his heart were to stop beating and all that. Or you can tell us you don't want that. If somehow he becomes lucid or something and he pulls his tube out, you would tell us if you want us to put it back in, because if he takes it out, it's not going to be long before something bad, would happen. So you would tell us if you want us to put that in. And those are the kind of decisions that you would let us know, so we know how to care for him if something were to happen in that field. As for his lungs, that's still, even if you want surgery, the surgeons themselves have to be comfortable with the surgery. And if they say all of a sudden we don't want to do it, then there's nothing we can do. I can't make them do it, and even the decision that you're okay with it wouldn't allow them to do it.
But if the family decides not to do the surgery, then we just kind of wait around?
Basically.
I mean, it wouldn't be imminent tonight.
It's not imminent tonight, I don't think. But
Something else
You never
happens.
yeah, but we don't know, because if he is bleeding,
Yeah.
and it builds up, the pressure builds up to where he does herniate the brain, that is almost immediate. Yeah. Thanks. But like I said, his blood is no longer thin, so if he was bleeding in the brain, hopefully it would be stopped by now, because we gave him clotting factors and we thickened his blood. So. But the problem is not the blood itself. Once we stop the bleeding, there's edema that occurs around the site of the bleeding, or that will cause more swelling in the brain. That's only if he did have a stroke, a hemorrhagic stroke. So we don't know though. We can't check. So I really am sorry to have to bring this to you, but I felt like you needed to be informed today.
Thank you.
Yes. I'm here for you. I'll be here. I switched to another place at the end of the month, but I'll make sure that whoever comes in, that they know that I try my best to keep you all as informed as possible and talk to you as best they can. Okay. Do you have any questions?
Yeah, I don't have any questions. We need to talk about the decision.
I got one more question. Yesterday, his lungs were doing a lot better than the day before. Or
Right.
I don't know, maybe not a lot better, but could it be that the bleeding started really recently in his lungs? Because does the amount of blood in his lung affect how well his lungs work?
It is true that the bleeding had to have started within the last 24 hours because yesterday morning on the labs, the levels for the blood thinner were normal. Something happened over this last 24 hours that we don't know exactly that caused the blood thinner levels to go 3 times the normal. And just don't know. Only thing I could say is it could be the kidneys, but we have no idea what caused it.
If he has the surgery on his lungs and it gets cleaned out, and then I'm guessing he's gonna have to go back on a ventilator, and is he starting all over from where he was?
He'll be on the ventilator through the surgery.
He'll be on it through the surgery, just on a different setting?
No, well, we can't just change the setting like that because if we change the setting, his body is not apt to do too well with it right now. The setting he has is full support, and if we change that, I don't see him doing very well with it because his lungs right now aren't in a good position to try to carry any extra effort that was already there. So,
If I may, I think that the surgery would remove the clotting, but it does nothing to alleviate the ARDS and the pneumonia and even those things.
that's correct. Yeah. It's a very difficult situation. Lots of different things coming down at one time, and very hard. Sorry.
Appreciate it.
Okay.
Being frank with us.
Yeah,
and
thank you for
giving us-
explaining everything.
And I'm okay. This room is yours. I'll just let everyone know. Just let you have it as long as you want. Okay. Okay.